Good morning. Myself Varun Kumar. Today we will discuss about the massage techniques which has been used in the physiotherapy. The massage techniques, which are the scientific, systematic manipulation of the soft tissues performed using the therapist hand or mechanical devices. And these each technique has a specific purpose, direction, depth, and rhythm and physiological effects in the human body. And the major massage techniques involved, which are the stroking manipulation, pressure manipulation, in that pressure manipulation, kneading, pit research, friction, and ironing, and then the tappement or percussion technique, then vibration, and then the shaking. The stroking manipulation. So the stroking manipulations are used as the light rhythmic movement using the palms or fingers along the length of the body segment. The purpose is to relaxation, to make a pain relief via the pain gate control and initiates or ends the treatment. So the techniques used are the hands in the relaxed position and long gliding strokes have been initiated. So direction are from generally distal to the proximal. The effects are sedative effect, and then it provides the enhanced lymphatic drainage effect, then it improves the patient therapist rapport. So the effleurage. So effleurage is also called as the Petrissage technique. In this where the firm gliding strokes along the muscle length using the full palmar surface. And the purpose for this is to warm up the tissues, prepare for deeper techniques, and increases the venous return. The technique involves a slow, continuous movement where the pressure applied from the therapist's body weight. And the effects are it increases the blood circulation, then it decreases the edema by applying the pressure, then it provides the relief from muscle fatigue. Then pressure manipulation. So the pressure manipulation includes the kneading, pit research, picking up, ringing, skin rolling, and friction. Either we can do it as a group, or otherwise we can do these techniques as an individual. So the kneading. So kneading is a rhythmic pressing or lifting or squeezing and releasing of the tissues. The types involved are palmar kneading, digital kneading, and then the thumb kneading. The purpose is to mobilize the deep muscles, reduce the adhesions, improve tissue elasticity. The techniques which have been used as a circular way or a rhythmic movement. It can be performed on large muscle groups, example quadriceps and then the back muscles. So the effects, effects are enhancing the muscle nutrition, decreases the muscle stiffness and then the muscle spasm, and also increases the joint range of motion. Then Petri search. The Petri search includes picking up, ringing, skin rolling. The picking up where the lifting the muscle between the fingers and thumb. Then ringing, we have to collected picking the muscle and we have to twisting it in the opposite direction. That is the ringing. After ringing, we can roll it from one side to another side. So that is the lifting, rolling the skin to reduces the adhesion. Then the purpose is to deeper mobilization and then the loosening the tight fascia and also it breaks the adhesions. So effects involves it improves the local circulation, it removes the metabolic waste, and it reduces the myofascial tension. The friction, where the definition is the small, deep, circular or transverse movement over a specific site. The types of friction involve circular friction or a transverse friction. The purpose is to treat localized lesions, break the scar tissues, align the collagen fibers. So the technique pressure applied with fingers or thumbs, no lubrication, and effects involves stimulates the healing, reduces the chronic inflammation, and increases the local blood flow. So the tappement technique or percussion technique. So the tappement technique are rapid rhythmic striking movements. So the types of tappement clapping by making the palm in a hollow palms and it strikes to the patient's skin. It commonly used for the chest physiotherapy. So hacking, ulnar borders of the hand, rapid alternate movement stimulates the muscle. So beating, looses the fist striking the surface and it's used for the large muscle groups. Then the pounding. So it's similar to the beating but deeper pressure suitable for the athletes. So vibration. So it apply for a fine oscillatory movement transmitted to therapist and purpose is to pain reduction, muscle relaxation and then a chest physiotherapy. So shaking. So larger oscillatory movements causing the segmental body shaking. Purpose is to relaxation of the limb muscles and reduction of the hypertonicity and also it affects decreases the muscle tension and then it improves the mobility. The physiological effects. So the physiological effects involves it stimulates the neuromuscular system, it enhances the muscle spindle activity, and it mobilizes the respiratory secretions, and also it increases the blood circulation. So the indication, chest physiotherapy, pre-event sports massage, muscle activation, muscle tension and spasm, chronic pain, edema, scar tissue and adhesions, reduced circulation, post-exercise fatigue. And the contraindication involves acute injury, open wounds, eye muscle tone or spasticity, acute inflammation, thrombosis, varicose veins, skin infections, open wounds, malignancy, and then severe cardiac conditions. The case example, The patient name is Mr. Ramesh, whose age is 38 years, whose occupation is an IT professional, and he has been diagnosed as a mechanical low back pain due to the muscle tightness and poor posture. So the management involves superficial stroking followed by the deep effleurage and also using the kneading of paraspinal muscles and finally by applying the precise. So mind map involves massage technique where the stroking manipulation, superficial stroking or deep stroking. The techniques involves the tap attachment, percussion, clapping, hacking, pressure manipulations, which involves the kneading, precise friction, and then vibration and shaking. So these are the overview of today's class, which is the massage techniques. Thank you.